dislocated shoulder is when the shoulder pops out of place. So the shoulder is a ball and socket joint, and with an injury, that ball can slip out of the socket. This is the socket of the shoulder, and around the socket is the lining of the shoulder joint, which we call the labrum. And this is what it gets injured. This labrum here is what gets injured at the time of a shoulder dislocation. I see shoulder dislocations more often in contact sports. So most often would be football. Rugby is another common one where you see shoulder dislocations. I've seen them in basketball from certain falls. And then for female sports, I've seen them in volleyball. So any kind of sport where you're working above your head or where your arm can get pulled back behind you, if you think your shoulder is dislocated, you need to go to the emergency room. If it's out of place, it needs to be put back fairly urgently. You're going to be in enough pain that you're going to want to find someone. If you can't get into an office, you need to go to the emergency room. Popping a shoulder back into place is just reducing the shoulder. So if the shoulder is dislocated, if the ball is sitting outside the socket, popping it back into place is putting that ball back in the socket. Occasionally we can do that on the sideline if we can get the player relaxed enough to do that. Often though, once the shoulder is out of place, the muscles around the shoulder become very tense, and it's difficult to get those relaxed without giving some sort of medication to help with pain. When you dislocate your shoulder, you can tear the labrum, which is the lining of the shoulder joint. You can fracture portions of the socket. Often if there is a fracture of the socket, then the recommendation is to go ahead and fix that. Other times, if it's just a dislocation with a torn labrum, sometimes that can be rehabbed. Patients that are older that maybe aren't returning to a contact sport, maybe you dislocated your shoulder falling down the stairs, don't always have to have a surgery because their redislocation rate is not as high. If you're involved in a contact sport, you have a significantly increased risk of redislocation after you dislocated once. So some studies show that teenagers that have had a shoulder dislocation and return to a contact sport can have between a 50 and 70% chance of redislocating their shoulder. If you've injured yourself and you've concerned you're dislocated your shoulder, I would recommend seeking medical attention right away. Often that would mean going to the emergency room where they can adequately evaluate you with x-rays, give medication if necessary to relax you and get you that shoulder back in place. After that, seeking an evaluation by an orthopedic surgeon who can then help tailor your recovery depending on your goals, whether surgery is not as necessary or there are further injuries that we need to evaluate.